Dr. Miller here, and I want to take a moment for the 7 o'clock talk tonight. Jessica is out. She is actually taking care of patients. And since we try to use this time now to go on bike rides and do things, and it's 50 degrees in February, we're probably going to end up going on a bike ride tonight. But that is beside the point. For those of you who don't know who I am, I'm Dr. Trevor Miller. I've been a chiropractor for over 30 years. I've been a functional medicine practitioner for that same amount of time, but I've been certified in functional medicine by the IFM for the last, 5 years or so. And tonight, I want to take a moment and talk about basically your hormones and how your hormones affect your sleep. And this is something very important to know and to talk about. And the first place we want to start is where does your body actually get the raw materials it needs to create your hormones? Do you know where it gets that? Do you know where that comes from? If you don't, I just happen to have a chart from Dutch, that's one of our lab providers. But as you can see, cholesterol. So if you aren't getting good forms of fat, so raw nuts, you don't want them salted, you don't want them with a bunch of extra stuff, you definitely don't want them processed with seed oils. You want whole raw nuts. That is one good form of fat. Your olive oils, your fatty fish, your avocados, these are all good sources of oil for you. And so, or cholesterol, I should say. So in America, we are actually pretty fat phobic. And one of the things I should have actually had a sample report for you is what do your lipids actually look like? What is their size? You've heard Jessica talk about the size of the lipid particle matters, and that's very true. Is it a small, hard, dense? Is it a big and dense? Or is it a big and fluffy? And if your particles are large, fluffy particles, then your body can actually use that cholesterol to make your pregnenolone and then to start to go into progesterone and the hydroxypregnenolones and then down into the DHEAs, and then you can go over here to the testosterones and the estrogens, and here you start to do the cortisols. So you have to have all of those. And if you're under stress and you are doing what is called the pregnenolone steal, and you're converting that into cortisol, then you're not going to sleep. You're going to be up. You're going to be antsy. The mind's not going to shut off. And there are things that we can help you with to do that. One of the hormones that you hear us talk a lot about is progesterone. And we have developed our own dosing based on standard and best practices that really seems to get the job done for our patients. And that helps them. But the other things, we kind of hit sleep last time, but we really got to concentrate on getting those hormonal levels balanced. And then one of the things that we like to do is not we, I should say, one of the things that providers like to do is we like it to be easy for our patients. The easier we can make it for our patients, then the easier it is for compliance. But your body is making hormones all the time throughout the day. That's why when we do a Dutch Plus, we take multiple samples. So you are taking multiple samples throughout the day and you're seeing what the trend is throughout the day, not just for cortisol and the cortisol awakening response. When we see the cortisol awakening response, we want your cortisol awakening response to follow this trend throughout the day. That's very important for you because cortisol itself has to start to minimize towards the end of the day so that you can actually get ready and prepared for sleep. And then as you go through your evening, it starts to ramp up in the morning hours to peak early in the morning and then to slowly calm down through the rest of the day. And then if you don't have that cortisol, we want to start to look at the hormones that you have and what are they doing? What do they look like? This is actually a female test, so we see postmenopausal, premenopausal ranges on there. But as we see those, we know we have to get those balanced. We know that we have to get you in a good hormonal rhythm throughout the day so that your body will be prepared at night for you to sleep. And then if you're not sleeping, there are things that we can do, there are herbs that we can use to help, not just melatonin. Melatonin is something that you can use, but once again, it's a hormone, and so you have to be very careful with how you use melatonin. But it does a lot of great things. So, as we look at this and as we start to think about sleep, you have to think about the hormonal portion of sleep. And of course, we talked about last week, we did talk about how are you eating? Is your room cold and dark? Um, if you have all of those things under control, then the next thing you need to really start to look at is where's your cortisol? Not only is where is your cortisol, but now how are your hormones doing throughout the day? Do you have enough hormones for you to actually have things working properly in the way that they're supposed to work? And then, most of all, do you have the things that you need to actually initiate sleep? And then there start to become problems. A, can you initiate sleep? And then B, can you maintain sleep? So we have people come in all the time with problems with maintenance and then problems with initiation. And you have to work those different ways, and you work those different ways depending on their labs. The other thing about this is I'm talking about hormones, but what makes your hormones? Well, your gut, your microbiome. And if you don't have a good gut and microbiome, then you're not going to make your hormones. You're not going to make your short chain fatty acids. You're not going to make your neurotransmitters. And there are ways to start to look at these things and manipulate them and help the body. The thing that we tell people is if you have a cup and you're pouring good things into that cup, if you're doing bad things, you have a hole drilled in the bottom and it's leaking out. We have to stop the bad things, plug that hole, and then we still need to help fill in the hole here so that you can do the things that you want to do and you work optimally. Medicine deals with having a hole and trying to band-aid the hole. Not only do we want to band-aid the hole and get you feeling better, but we want to fill that hole in so that you work optimally. And so, knowing what your hormones are and knowing if you're doing the cascade so you get all the good things out of the food that you eat. And not only that, your liver actually creates 70% of the cholesterol that you need a day. But you can't be throwing in sugar, which oxidizes the cholesterol. You can't be throwing in alcohol, which oxidizes the cholesterol. You cannot attack the body continually that way because it does change the way that your body processes and makes the hormones. It changes the way your body processes and makes the short chain fatty acids. Your body, if it's stressed, will go to the amino acids in the gut first and start to take that out. So you're going to lose the lining of your stomach. If you're stressed out of your mind, cortisol is going to raise and your gut is going to become leaky, but then you're going to also get thyroid problems. So these things are all related. And that's one of the major things that I want you to start to grasp and get a hold of. It's like politics. People want to say, oh, is it the food that we're eating, or is it the way that the food is harvested? It's probably both. You know, we've hybridized stuff so much, which is it good or is it bad? I don't know. But we see that we have problems. So I tend to think that it's all of the above and it's all of the way that it works together. Now, if we get the person in here that has a simple issue, then simple fixes. We're starting to get more and more people in that want to optimize their health. And yeah, then it is simple fixes. But when you have a sick person or a chronically sick person come in, looking at just hormones, looking at just the microbiome, looking at just the organic acids, looking at just the omega-3 fatty acids, that's such a small part of the picture. You know, it's kind of like the picture you're seeing here on the wall. You don't see everything. So you want to see the whole picture, not just a part of the picture. Because if that's all you're seeing in the picture, you don't really know what it's about. And that's what lab testing allows us to do. It allows us to pull back the curtain and see the whole picture. And that's where we like to get these large 50,000 foot views, what have you, and looking at a person's body, because we get the people that other functional medicine practitioners have failed at, that are the chronic hard cases. Those are the people that we get. And so we get tons of blood work. And blood work is such a small sliver of what that person is. Gives us an idea. It gives us clues, but it doesn't. Like somebody who is having problems sleeping, for instance, their blood work typically always looks pretty normal. Now, is it optimal? Not usually, but it's normal. And so then we have to dig in and see why. What's breaking down? Why does this person have maybe slightly elevated liver enzymes? Why aren't their kidneys working optimally? And those things all start to add up. And then our job is to come in here and start to pick these things off one at a time or several at a time. Allow the body the chance to heal and do the things that it should do. Because once you start to get these rolling and your body gets progesterone going and you have cortisol under control, then all of a sudden going to sleep, staying asleep, waking up rested, healing, it all starts to work because the body wants to work properly. The body doesn't go out of whack on a whim. It just doesn't. There are reasons, and your doctor should always ask why. Well, that's all I have for tonight's 7 o'clock talk, and we'll see you next time. Oh, well, and as always, if you do need help, look towards Integrated Health of Indiana. You can go to our website. You can do a 20-minute consult free of charge, and we can start to help you figure out what's going on in your body so that you feel the best that you can feel.